Greetings. Now we're going to go over some more urinary disorders. Here are your objectives. So this is just the presence of calculi or renal stones. You can have stones in the ureter, kidney, or the urinary tract. The reason these become an issue is they're very painful. I'm sure you guys have heard that if your male patients have kidney stones, that is the closest to childbirth that they'll ever come close to. Also, some other issues is the stones can, as you see here, can block the flow of urine, the flow of just block the mechanisms of the kidneys. Risk factors, there's a big family history. If you know your mom, dad, grandparents had them, that does increase your risk. If you're not drinking enough and you're very active, that can also increase the risk. Your diet, digestive issues, diet is not considered a risk factor. However, calcium greater than 100 milligrams daily and vitamin D substances can increase the risk. As we know that stones, the most popular type of stone is a calcium stone. Being obese, high body mass index, weight gain have been increased to an increased risk of kidney stones. Digestive issues and even abdominal surgeries, the gastric bypass surgery, all of that can increase your risk. The lifetime incidence of kidney stones is nearly 13% in men, 7% in women. Once an individual has formed a stone, the likelihood of reoccurrence is 50%. That's a lot. At 5 years, and then up to 80% at 10 years past incident. So that's a lot. I would like for it to be 0 because they're very painful. Kidney stones vary in the geographic areas, race, and family history. Your white patients are at a more increased risk. Most stones are found in the male population with a Sturvite stone. Women more often have more incidence to have UTIs than men because of these stones. Like I said, the most common type is calcium. So here are your different types. You have calcium, struvite, uric acid, and cysteine. So your calcium, of course, is made of calcium, especially if you're taking high doses of vitamin D. Your struvite stones form in response to infection, especially UTIs. Uric acid stones are going to be seen a lot with patients that eat a high protein diet or who have gout. And then your cysteine or cystine stones, these are the patients that have a family history of renal calculi. Signs and symptoms, very, very painful, 10 out of 10 pain, blood, hematuria, vomiting, nausea, burning in the abdomen, fever, chills. You're going to do your assessment. You're going to perform that urinalysis as well as your CMP, CBCs, all of that. Make sure that you're doing good patient education on if they have ordered, if your provider orders pain medicine, you want to make sure that the patient is requesting it sooner rather than later. so that you can keep their pain under control. You're probably going to be pushing fluids unless they have, unless they get dialysis or they're on a fluid restriction. And then the doc may also want you to encourage cranberry juice, but they do want to increase their fluid intake. Some other treatment plans, it could be that they have laser removal. It could be that they do a scope. They may, the lithotripsy is where they go in and it's a laser or sound waves to break up the stones. You will have to give them a strainer. That way every time they pee, they strain their urine to see if they have passed their kidney stones or not. Some risk factors for cancer. These are just some, I'm not going to go over all of them, all of the risk factors, just the primary risk factors: people who smoke. The number one sign is painless hematuria. Some of the diagnostic tests goes back to those same diagnostic tests that we've discussed: possible biopsy, CT, MRI, cystoscopic procedures. Of course, you'll do your urine, lab work, and then so let's talk about the different types. They are classified as, there's three different ones we'll talk about: transitional cell carcinoma, squamous or squamous cell carcinoma, and adenocarcinoma. Bladder cancers often start in the inner lining of the bladder. They represent about 3% of all malignant tumors and are the fourth common malignancy in men and are most common in men over the age of 60. Once it passes transitional cell, it is highly invasive to the liver, bones, lungs, as well as the lymph nodes. Very, very scary. So some of the treatments is definitely surgery. They may have to do a TURP, which is the transurethral resection of bladder. This is done through a cystoscopic procedure, or they may have to do what they call a radical cystectomy. This is the removal of the whole bladder. Some of your nursing interventions would be patient teaching. What do they look for? What do they monitor? Signs and symptoms of infection. Are they on special medications? What kind of appointments will they need? Are they immunocompromised? All of those things. So this is just talking about your urinary diversions. That picture is a very good representation of it. Incontinent diversion or urinary conduit. This is the intestines is used as a tube, connecting the ureters to an external collection bag called a urostomy bag. Cutaneous urinary diversion or continent diversion. This is where they will surgically take the intestines to be used as a urine reservoir to collect urine, and it can be drained with a catheter inserted into a surgically placed opening in the abdominal wall. A neobladder, this is just a reservoir. It can be made with the intestines, and it's actually attached to the urethra. This will allow for a patient to urinate as if the bladder were still present. It may require catheterization for full neobladder emptying, so make sure you look over those. That is it. Once again, if you have any questions, if I've confused you or misspoken, please make sure you email me or set up a time to come see me. Thank you.